Now, if we talk about the etiology of vitamin B12 deficiency, the first and the most important reason is inadequate intake. Generally, the vitamin B12 has sufficient store in the liver to last for years. It may last for 1 or 2 years. So, basically, if the person is ignored or if the person doesn't take proper meals for many days, then this deficiency crops up. And basically, the first reason is inadequate intake. Second is that if there is intake is alright, but something wrong with the absorption, that is the second most reason. Third is decreased utilization, and sometimes drugs also can cause problems with the vitamin B12. Now, inadequate intake is mainly seen in the vegans because we have seen that vitamin B12 is found in not only the meat products but also in the milk and the milk products and dairy products. So, therefore, it is unlikely that vitamin B12 will happen in vegetarians. But the people who are vegans, the people who do not even consume milk products, they may go into this. That also after a long time. Breastfed babies of vegan mothers are also at a risk for vitamin B12 deficiency because we must remember that the child derives its nutrition mainly from the mother, so it can be there. Now, inadequate absorption of vitamin B12, if we take step by step, this is a large diagram, but I'll try to simplify it. The first and the most foremost in elderly people is decreased production of the acid. Now, acid is required for the breaking of the heptocorrin from the vitamin B12. So, because acid is not there, so it is we are not able to liberate the vitamin from the heptocorrin. This is the first thing. Second thing is that their absorption may be decreased. This can occur in blind loop syndrome, sometimes in surgery or in intestinal stasis. We may have areas which are not doing properly, which are not having peristalsis properly, or they are isolated. They form loops, and these have bacterial overgrowth. These bacteria can consume the vitamin B12 and result in a deficiency. Then there is a fish worm which is called Diphyllobothrium latum, which is found mainly in the Scandinavian countries. It's a tapeworm which is found in the fish actually, but it can infest the human beings also. It also consumes the vitamin B12 in the gut and creates a deficiency. Then, if the ileal sites are destroyed, especially in cases of Crohn's disease or tuberculosis is another important disease which affects the terminal ileum, or if there is some surgery which has been done. So this can also, because the main site for absorption of vitamin B12 is the terminal ileum. Then chronic pancreatitis. As we all know that to dissolve the vitamin B12, the heptocorrin, to destroy the heptocorrin, we require the pancreatic enzyme. So heptocorrin remains attached to vitamin B12, then it cannot be absorbed. So heptocorrin has to be destroyed, and in its place we have to attach the intrinsic factor only, then it will be absorbed by the terminal ileum. ये गलत हो गया है, इसको बंद